My name is Justin Harshorn. I'm a student physical therapist. For educational purposes, are you okay with me recording today?
Yes.
Perfect. So what I want to do is we're going to start with 2 strength tests to see how well that shoulder is holding up and the shoulder musculature around that. Is that okay with you?
Yeah.
Okay. First one I want to test for you here is with your right arm. Go ahead and bring that all the way up to the ceiling for me. Good. Come back to halfway. And I want you to hold it here. Don't let me press you down. Good. Hold, 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 hold. Good. For video purposes, we'll say it was a 3 out of 5. Now go ahead and come on to the inside, elbow at your side. Bring your hand to your belly button. Good. Come off of it just a little bit. Now hold it here. Don't let me bring you out this way. So hold it there. Hold, 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 hold. Good. Again, for video purposes, we'll say that was a 3 out of 5 as well. All right, so now we'll go into some special tests. The first one I want to do is called the Hawkins-Kennedy test. It's going to test some of that rotator cuff and shoulder strength muscles as well. All right, so I want you to go ahead and relax. I'm going to bring your arm up this way. Hold here. I'm going to bring you down into internal rotation. Go ahead and relax for me here. Good. All right, so we'll say that produced pain for the patient, so that would be a positive test for the Hawkins-Kennedy. And then the next one we're going to do is an internal rotation lag sign. So I want you to go ahead and bring the back of your hand like you're scratching your back. Good. I'm going to go ahead and gently pull your arm off of your back, and when I let go, I want you to hold your arm in that position here, okay? Good, so hold it here when I let go. Try to hold it, try to hold it, try to hold it. Good, and relax. So we'll say again, for video purposes, she was unable to hold that position, which means it would be a positive sign, testing for that subscapularis muscle as well. All right, so now to get into some interventions to help address those impairments. First one we're going to start off with, we're going to address that shoulder flexion strength. So essentially what we're going to do, we're going to kind of use the Jobe test, or the full can test, excuse me, as kind of like an intervention. So we're going to pretend like this is a 2-pound weight. What I want you to do is come over to the edge of the table for me. You're going to hold this weight about 45 degrees from your body with your thumb up towards the ceiling. You're going to come up to 90 degrees, hold it for 1 second, and then nice and slow down in 4 seconds here. All right, go ahead and do that for me. So 45 degrees. Come off to the edge of the table for me. There we go. Perfect. Good. Up. Hold it. And then nice and slow. Good. And really think about pushing that shoulder down and squeezing your shoulder blades together to help depress the scapula and really focus on those shoulder stability muscles. Good. Go ahead and do 1 more rep for me. Hold it. Nice and slow on the way down. Perfect. So I would have you do 3 sets of that for 10 reps. All right, now for the next intervention, go ahead and lie down with your head on the table. Lie on your side for me. So this one's going to be a sleeper stretch with extra resistance to help target those internal rotation muscles. So what you're going to do is I'm going to hand you this band here. What I want you to do is think about bringing your palm down to the table for me here. All right, just as far as you can tolerate with resistance. Hold it. Come back nice and slow. Good. I'm going to give you a little bit more slack here. 1 more time for me here. Good. Hold. Nice and slow back. 1 more. Let's do 3 reps for this one. Good. And then come back nice and slow. So again, that's going to target the subscapularis impairment. Again, 3 sets by 10 reps to help strengthen that muscle. All right. Do you have any questions or anything for me?
No.